Okay, I think we'll go ahead and get started. So welcome everybody. My name is Peggy Kirk and I am the president and CEO of the Shirley Ryan AbilityLab. But more importantly, I'm a nurse and a rehabilitation nurse. So thank you very much for joining us and listening to what we think makes us so special and such an incredible place to be a part of. We're hoping you'll learn some things about us and maybe be inspired. So the Shirley Ryan AbilityLab, formerly the Rehabilitation Institute of Chicago, is the very best hospital. Now, you might be thinking, sure, you're the CEO, of course, but I'm telling you that based on my 40 years of experience in this organization. And I couldn't be prouder. I just mean that from the bottom of my heart. I actually started here as a new grad staff nurse. And I thought, I'm going to stay around for 2 years. That'll be great. I'll get some experience and I'm going to go do something else. And I never got around to leaving because I just fell in love with everything that had going on here. Even as a staff nurse here, I was able to get involved in things that I never imagined I would. I got involved in research. I did some research on bowel, bladder, skin, all the things that nurses love. I even got to publish. And I'm not that much of a writer. So, but it was inspiring and it just helped me build my practice. I loved the mission and the vision of the organization, my colleagues, both that were nurses and therapists and physicians. This place is an incredibly collaborative place, which has a really interesting balance because you get to work with the best of the best and learn from them because they're coming with a different training and a different background. For instance, physical therapy or physicians or APPs, you name it. I got to learn from them, but then they got to learn from me because I was the expert nurse on the team. And I just love that. So in my career here, I was able to, as I said, publish, do research. I became a nurse manager, had multiple other leadership roles. Every time I turned around, it seemed like there was another opportunity for me if I wanted to do it, right? The other thing I want you to know about this organization is that we are totally exclusively exist for our patients. We are driven to get the very best outcome for our patients. And we know the path forward with that is having a very engaged, passionate, talented team. There's nothing more wonderful than that. The other thing I want to tell you about this place, if you have not been here, you'll be surprised because, right, we take care of patients who've had devastating injuries and their life has changed quickly. Yet it's filled with joy and inspiration, and you get reminded every single day about resilience, and it's just hopeful. And our patients will tell you that too, joyful and hopeful. Okay, so I bragged a lot, but what I really want to do is introduce the team here to tell you about their experiences in this organization. First up will be Karen Colby. She is our Chief Nurse Executive, along with a whole group of staff nurses. So I hope you enjoy learning about us. Karen?
Thank you, Peggy. I also thank you for joining tonight with us. We are very proud of being the top rehabilitation hospital for over 31 years, as well as a magnet designated hospital 4 times over, which speaks to our excellent nursing care and patient outcomes. I always tell nurses when they look for a job to find a hospital that is magnet designated and one that has a nurse residency program, and we have both. We offer graduate nurses an accredited highly distinguished nurse residency program to help them transition into practice. At Shirley Ryan AbilityLab, a magnet organization is a place where rehabilitation nurses have a voice and are empowered to improve patient outcomes and grow as a professional. We are a specialty like no other and have so many opportunities, but instead of for me talking about it, I really want to introduce the nurses that are living it day to day. They can speak about how special Shirley Ryan AbilityLab is and highlight a few areas such as patient relationships, development of nursing skills, team collaboration, research, career development, and opportunities for growth. Those are just to name a few of the opportunities that we have here at Shirley Ryan AbilityLab. So I'm going to turn it over to Matt Grissom, who is our clinical nurse leader on the spinal floor.
Hi, thanks Karen for the introduction. My name's Matt. I've been a nurse here in various roles since 2014. And before that, like Peggy, I was a nursing student. And also, if I'm being honest, it was never my intention either to be here this long, because I wanted to see it all. I was going to go do acute care and community health and mental health, everything, you name it, I was into it. But what kept me here, besides fantastic and support coworkers, is really the patient relationships. Our patients stay a lot longer than in acute care, 2 to 4 weeks on average. And some floors, like mine, the spinal cord floor, many patients stay twice that long. And what I discovered was all those experiences that I was after as a new grad, they're right here. You get your highly acute patients after life-altering trauma, and then you actually get the time to build that therapeutic relationship to actually achieve that holistic approach to your practice, where you have the opportunity to focus as much on health promotion and returning to the community as you do disease management, I suppose. And the resources we have to make that happen are incredible, from the prosthetics and orthotics team, the therapeutic rec, assistive technology. It's all here, and it's all at the bedside too. It's not an outpatient appointment a month from now. It's an appointment tomorrow at your bedside. And more about the relationships with the patients. It's really the time that we have here with them allow for you to make really strong bonds with patients and their family. You witness their journey. You get to see them and help them overcome their obstacles. They become like family. And something that I've discovered working here is that that story about the triumph of the human spirit, where somebody was never gonna walk again, and through the power of perseverance, whatever, that's not the exception. That's more like the rule. I mean, when Peggy says that this place is filled with joy, it really is. Everyone has that power and that spirit in them, and to be a part of helping them let that shine is really the most special thing I've ever been a part of. And with that, I'm going to pass it off to Addie, who will tell you a little bit more about the range of skills we get to use with our pretty complex patients.
Oh, thank you, Matt. Greetings to everyone joining. My name is Addie. I started here 2013. So I've been here for like 9 years. It's been quite an exciting experience. I get to see different kinds of diagnoses. When I started as well, I thought that I would be here for like a year or 2 years, then I would, move on to another acute hospital, really. Well, when I joined Shirley Ryan, I found out that it's not just a rehab hospital, it's an acute inpatient rehabilitation hospital. And so we see all different kinds of patients, ranging from, heart failure to stroke to brain injury. I remember working in a medical complex unit and getting to take care of patients with cardiac assistive devices. And that really thrilled me. But the good thing about working here is that there's always opportunity for learning. You don't feel intimidated at all. There's always, opportunity for you to grow, even to ask questions. So when I joined, there were so many things that I did not know, but someone is always available to answer questions. Someone is always available to take you through the learning process. So I was able to get comfortable. I started enjoying working here. And then I remember after like 2 years of being here, I was challenged enough and I wanted to go back to school. I started my master's. I finished, I went back for my doctorate. It's just a lot of things that challenges you to want to know more here at Shirley Ryan. Initially, I thought that, we would not be having to do like IV medications because it's rehab. But here you get to do everything that, all your skills, nursing skills, you get to put to use, giving, some medications that, it can only be given in acute setting. you get to do here. TPN, we do administer here. So I just feel like Shirley Ryan, it's the right place to be. A lot of opportunity for growth, a lot of things that excite you every time you come to work. You see patients that came in on vent, unable to breathe at all on their own, and you give them, some weeks, they're able to be weaned off the vent. They're able to be even decannulated. Family is excited, and eventually they get discharged home. It's just highly rewarding to be here. So I want to pass it on to Caitlin. I'm sure she has much more to tell us, especially about team collaboration.
Hello, everyone. One of the things that I truly value here is teamwork and the collaborative spirit and understanding that runs through the entire organization. Before taking a position here many, many years ago, I had the opportunity to come in and shadow a nurse. So I came in and spent 4 hours on a complex medical unit. And I remember the teamwork and collaboration that I saw just within those 4 hours was so remarkable that it played a key role in me making the decision to join Shirley Ryan. So as a staff nurse myself, I had the opportunity to work very closely with physicians, with other nurses on the unit, with care managers, unit managers, everyone. We were all on the same page. We all knew the goals that were set for the patient, and we communicated whenever that was necessary. We communicated through communication boards. We had team huddles. We had team conferences, and all of that was to ensure that we provided the best possible care and the best possible outcome for our patients. There was trust, there was respect for each other's role and responsibilities. I had a lot of autonomy, as well as the ability to contribute to decisions that affected the care of my patients. And in my current role now as a house supervisor, the commitment to team collaboration is still the same, it's still evident at all levels in the organization. I work very closely, not only with the clinical team, but with all other departments, from food to security to pharmacy to central supply, and all of that to make sure that nurses have the resources, the tools, the equipment that they need to provide, again, the best possible care to our patients. I am so proud to be a part of this team. So I'm going to pass it on to Emily, who is one of our clinical nurse coordinators, and she will speak more about growth opportunities here.
Hi, everyone. I am Emily, and I am a clinical nurse coordinator on the 23rd floor Brain Innovation Center. I have been here for 5 years, and I actually started out as a nurse intern 5 years ago. And one thing that really stuck with me when I was a nurse intern was how many nurses had started out as interns and had taken on roles within the administration. One thing that I think is really unique about our administration is how approachable they are. I have had sit-down meetings with both Peggy and Karen where they have allowed me to pick their brains on career development, and they have given me their advice and tips and tricks on their successes, and they both serve as great mentors to me. Like I said, I started out as a nurse intern. I grew to be a night shift nurse, and then I came to day shift, took on a role as a clinical nurse coordinator, and even spent some time as an interim nurse manager. I think it is really special how much devotion Shirley Ryan AbilityLab gives to our nurses and encourages us to grow within the organization and go after those goals that we have for ourselves. So I'm going to pass it on to Kristen, who is going to talk more about leadership in the organization.
Hi, my name's Kristen. Just as a little background, I'm a second career nurse that completed an accelerated master's program. I was introduced to Shirley Ryan AbilityLab as a nursing student. I completed my capstone. That was 10 years ago, and I've been here ever since. So when I think back to when my first year at bedside, I would often reach out to my nursing student colleagues and have discussions about, their experiences with their job. And I immediately realized that there was something different about Shirley Ryan AbilityLab. When I would talk about what was offered in terms of opportunities at Shirley Ryan, they were not being offered at those other facilities. So early on in my bedside career, my manager often approached me about, engagement in committees, various quality improvement initiatives and pilots on the unit. I was introduced to the PNAP program, which is Professional Nursing Advancement Program. This is an annually running program that mentors nurses through professional development. You set up commitments that help develop your skills. And additionally, this is tied to a bonus. So the idea is that you give to the organization and the organization gives back to you. And it's a very unique opportunity that not a lot of organizations have. As I was developing my own individual career path, I was afforded several opportunities, which really solidified my advancement course. So I was one of the first 2 nurses to actually initiate the clinical nurse leadership role here at the organization. I'm very proud of that. And now we have clinical nurse leaders throughout our units. I also, like my other colleagues, engaged in an interim manager role, a clinical nurse coordinator, and now I've settled out in patient safety and accreditation as a clinical quality coordinator. So these experiences really gave me open access to what is available here at the organization. Because in nursing school, you might think of like a professional development track for nurses being bedside nurse, nurse manager, all the way up to CNO. But there's really so many more opportunities here at our organization. Whatever your area of interest is, we have it. Clinical education, quality improvement, patient safety, even nursing informatics and research, as we've talked about. All those opportunities are here. And what's even more encouraging is that our leadership is invested in really forming those bedside nurses down their unique career development pathway. And they give you all the opportunities and experience to complete that. So now I'm going to hand it off back to Peggy and Karen.
Thank you. I am so amazed by you all and so proud to be the CNO at Shirley Ryan AbilityLab. I came here almost 5 years ago and was so impressed with the staff, the development of the staff, just the drive for our mission and vision. And I know I chose the right place to be in my career at this time and to be working with all of you. So I'm extremely proud and appreciative and blessed to be working with you and to call you my colleagues. So at this time, I'm going to ask if anyone online would like to submit some questions to the chat to any of our panelists, and we can review those and answer those as we go along. So let me see if there's anything in there at this time. Okay. We do have one question here so far. We said, which I kind of answered in the beginning about, do you have a nurse graduate RN residency program? And we do. We have an accredited nurse residency program. That's a year-long program for our new nurses to transition into practice, which has dedicated time for onboarding and orientation, and then continuing touch base with didactics and classes until they graduated at a year. So, and then that's something that they can then move on then to that next level, as just what Kristen was saying about professional ladder advancement or professional advancement program. Let's see, how about, oh, here we go. Do you offer any specialty programs for weekends or weekdays? And actually, we have a very flexible scheduling system for our nurses. When you're in orientation, you work along with your preceptor, but then afterwards, you're hired into different shifts, and we do 12 hours, 8 hours. We also have a weekend program that actually has, you can work every weekend, 24 hours, but then get paid for 32. So, which is a great opportunity for those experienced nurses too. I'm seeing another one. Okay, here's a great question, which I think is really on all of our minds. It's what is done to cultivate a healthy and supportive environment within Shirley Ryan AbilityLab? So I have a couple answers, but I'd love to hear from our nurses' perspective, our panelists. Does anybody want to take that on?
I can speak to that a little bit. So, as we kind of touched on, there's a lot of opportunities for mentorship and growth. And I think that our managers do a really good job working with the mentors and the onboarding process. We also have our clinical instructors who are both in the academy off the unit, but we also have clinical instructors who are on the unit who are working with our preceptors to really onboard staff. And additionally, we've got a lot of shared governance committees that we like to engage our clinical staff with regard to all the decisions that are made. And we really listen to our bedside staff, our bedside nurses. This is a lot of grassroots up in this organization where you don't see that in many organizations. And I really feel like the nurse leaders listen to our clinicians and respect their opinions and really use them with regard to decision-making throughout the organization.
Great, thank you. Anyone else want to add on to that? To key a point that you mentioned, Kristen, about a shared governance, I like to call that shared leadership. Those are our councils that are led by clinical nurses, staff nurses, sponsored by a leader, maybe myself or another manager, but it is ground up. It's nurses driving the practice at the bedside. So we have a nursing practice council, which Matt is actually our chair of, that he has representatives from all over the organization that come together monthly and talk about areas of improvement for nursing practice and patient outcomes. So we do have a very supportive structure in place. Both Peggy and I do not sit in our office with our doors closed. We're very open to hear suggestions because who knows best than those people taking care of our patients at the bedside.
And I would also add that nurses, I feel, have a voice here. Their, opinions and contributions are very well respected. And the leadership team is very open and approachable. I mean, you can go at any time to Karen and, with any concern or ideas that you may have. So I think that's truly helpful here.
Yeah, it's no one thing really that makes the culture so nurse positive here, but definitely, all the opportunities in the shared governance for the opportunity to get involved in how care is delivered here is right at your fingertips. It's so easy to get involved, and between that and the open door policy, having nurses in leadership positions really all over the hospital, nurses are taken very seriously here, and so we're it's a very just nurse positive environment.
Yeah, and the interesting thing about that, it's so fun listening to you guys because so much of what you're talking about, I experienced the same thing 40 years ago, right? So what I will say to all of you is that this culture is incredibly special, but it's also really enduring. It has been here through my entire career, and I just feel so fortunate.
Okay, I'm going to see if there's any other further questions here. One here, what are some of our benefits like tuition reimbursement? So we do have a very robust benefits program, and one of it is tuition reimbursement. And a little story about that, a few years ago, our nurse, one of our councils, came forward and said they wanted to try to raise tuition reimbursement because we weren't giving the full amount that we are allowed under the law, IRS guidelines. So a nurse driven said that would be something we would do to go across the board. So we offer $5,250 a year for $5,250 a year for tuition reimbursement. So that's the max amount, non-taxable. So that's something that was, we felt that it was a good for our retention and for recruitment. And that was one of our councils we have is retention recruitment, to look at ideas coming from staff and then escalating up. And Peggy and our other leaders at that time approved that. So that is something that everybody takes benefit in the whole hospital. Okay.
So I think, did you see anything else, Karen, that you want to respond to?
I'm just checking right now. I don't see anything in there. No
Okay.
other questions at this time.
Okay. Well, I want to first thank our panelists. They did a beautiful job representing the organization, and just moments like this just continue to make me so proud. And I want to thank all of you who joined us. We are, as you might guess by this call, actively looking to recruit nurses to our organization. And I really, really would encourage you to at least take a longer look at us, whether it's to come here and shadow a nurse, or we could set up one-on-one conversations, however, whatever you need in order to go through your decision process. But your first step is you can visit our website at SRA Lab. So Shirley Ryan Ability Lab, all one word, sralab.org/careers. Or you could call our Human Resources Department and speak to our nurse recruiter. Raza is her name. And let me give you her number. It's 312-238-6294. I'm gonna say it one more time, 312-238-6294. We would love to hear from you. All right,
Thank you.
Thank you.
Thank you so much.
Right.
Thank you.